It's an honor to recognize Dr. Karen Schetzina as our Notable Woman 2014. As her nominator writes, this remarkable pediatrician is a tireless advocate for women and children and families. Dr. Karen Schetzina is the embodiment of the ETSU vision of a regional university that honors the rich heritage of Southern Appalachia through distinctive research and regional stewardship. Dr. Schetzina is a tenured associate professor of pediatrics and chief of the Division of the Community Pediatrics Research. She has served on the State of Tennessee's Perinatal Advisory Committee, as a reviewer for the National Institutes of Health, and as a coordinator for the ETSU Interprofessional Education and Research Committee. She's a nationally recognized expert on childhood obesity and breastfeeding, who has dedicated her career to improving the lives of children and their families, not only through her research, but also by developing strong community partnerships. She has collaborated with departments and colleges at ETSU like psychology and public health, as well as with universities like Wake Forest University in North Carolina, to fund initiatives that promote healthy living in the region. It is because of her dedicated leadership that many programs and many services have been provided for underserved women and at-risk children in rural Appalachia. For instance, Dr. Schetzina was instrumental in the establishment of the Breastfeeding Coalition, known locally as BABE. Breastfeeding advocates benefits everyone. That provides our community with a strong support group for breastfeeding mothers and mothers-to-be. She's also responsible for grant monies that created the Read and Play for a Bright Future initiative that supports research, advocacy, and activities to improve the health of children, mothers, and families in the region. And for any moms who have recently enjoyed a baby rest stop at a local fair or a festival, be sure to thank Dr. Schetzina for her brilliant idea for a baby-friendly area with comfy chairs and a tent for shade and privacy to support mothers who breastfeed their babies in public venues. Dr. Schetzina's focus is not limited to her own research and community initiatives, but also extends to the success of those around her. As her nominator wrote, Dr. Schetzina, and I quote, has probably mentored more medical students, residents, and graduate students than anyone else in our department in this area of research. She is dedicated to helping others succeed and has ignited a fire in the area of community research, inspiring so many others to take up the challenge of improving the conditions for those in the community who are at risk and underserved. Dr. Schetzina is a phenomenal woman, mother, leader, physician, scientist, and colleague. The Women's Studies program is delighted to recognize and honor Dr. Karen Schetzina as 2014 Notable Woman of ETSU.
Well, I sincerely appreciate this award, and that was quite an amazing introduction. Thank you. I'm very grateful for the opportunity to speak tonight. It's made me think about and wonder why I was chosen. I know and I have known so many notably amazing women. Dr. Beth Bailey is certainly among them. She's a talented educator, amazing researcher, and quite skilled at communicating results and importance of research results. Every time I've heard her speak at a conference or grand rounds, I've wanted to be more like her. So that story, unfortunately, of receiving a phone call from the state that includes $1 million is not common in academia or life, but I'm not surprised that it happened to her. I appreciate the nomination by my colleague and friend in the Department of Pediatrics and consideration and selection by the committee. I enjoyed having lunch with Dr. Thompson after my selection and learning more about her valuable work as Director of Women's Studies here at ETSU. So why do we need a Women's Studies program or this award? The ETSU Women's Studies program encourages all of us to question assumptions, see past our own values and norms, and look beyond stereotypes. The breadth of the program is impressive. It fosters critical thinking, leadership and collaboration, celebrates diversity, and promotes safety and well-being on our campus and community. My mother was elated when she learned that I was receiving this award. She immediately told all her friends, and as usual, was fiercely insistent that I was deserving of this award. She is a former teacher, and throughout my childhood was an active participant in school and community programs for children. She continues to support women's organizations in her community. We talk frequently about my work in maternal child health. She said I should talk tonight about what else needs to be done. So that's what I'm going to do in part, and also weave in some stories of personal experiences and journeys, as well as initiatives of the ETSU Department of Pediatrics and our many collaborators and partners. My mother was supposed to be here tonight, but through a comedy of calendar and communication errors, we had her book her flight for next Wednesday. It's still nice, as she will be here with us for Thanksgiving. And I know that she will be able to view my talk online because the Women's Studies programs post these speeches as YouTube videos. And this weekend, I really enjoyed watching those speeches from the past 4 recipients of the award. And if you haven't seen them, I encourage you to check them out. They're all unique, engaging, and inspiring. I'm a pediatrician. I care for kids, but as a pediatrician, I engage a lot with their families too, their parents, and most frequently their mothers. Children's health and well-being are tied to the health and well-being of their parents, not just genetically, but because of the home environment that parents provide. Recent research shows that even before birth, the home environment of the fetus inside their mom is influencing not just their birth outcomes, but their potential for health much later in life. I grew up in North Carolina, and my father was a physics professor. I have a photo hanging in my office of my younger sister and I on my 6th birthday. I had just opened a toy stethoscope and was beginning to examine my 11-month-old sister's heart. In the photo, like some of my young patients today, she appears somewhat reticent and is attempting to remove my stethoscope from her chest. My sister is married and is an absolutely wonderful mother of 3 boys. She works as a successful freelance writer, and she's a dear friend to many and to me. During my childhood, I played. I ran out the side door every day and didn't come home until it was dark and the lightning bugs were out working their magic. Throughout my schooling, I acquired a talented group of friends with diverse interests. They are now artists, dancers, statistician, computer scientist, writer, filmmaker. Those relationships influence my diverse interests and continue to even today. When I was born, the American workforce was comprised of only 30% women. My own mother stopped teaching when I was born to stay home with me, and she did everything with me and later with my sister. Today, women comprise almost half the U.S. workforce. In fact, the percentage of families in which the mother is the primary breadwinner has quadrupled in the past 5 decades and now is at 40%. While more women are in leadership positions than ever before, on average, women still earn only 77 cents for every dollar that a man makes, and this gap varies disparately by race, ethnicity, and even place of residence. Women are more likely than men to live in poverty. More men today and women are remaining unmarried. More women are never having children. Those who do are marrying later, having their first child later, and having fewer children. Issues of child support, affordable housing, healthcare, and childcare, programs to prevent hunger and improve nutrition, and services for older Americans are all immensely important to the future of women in America. It's essential that we're informed and are active participants in these decision-making processes. Despite the changes in the workforce, women are still more likely than fathers to be the primary caregivers to children in a family. I was talking with my sister the other night about being both a primary caregiver and a breadwinner. How difficult, how exhausting it can be. She commented that she had recently looked through photographs of their family and realized that despite the exhaustion, they're actually doing it. They're making it, they're providing the life and opportunities for their children that they wanted. And that maybe the work, the worry, the exhaustion, that's just part of being an adult. I think in those difficult and exhausting periods of life, it's important to find moments to stop and reflect and appreciate what you're accomplishing, what you have that you value. At work, with your family and your friends. My own mother's ability to triumph over adversity, still living independently, finding joy in her family and friends, still parenting her daughters, and making a difference in her community gives me hope that we will be able to continue to do the same. We all experience stress, even children, and it's important to have an outlet to help you manage it. So whether it's exercising, reading, music, cooking, art, these are all among my favorites. But running is most important. I've never been much of an athlete, but I can put one foot in front of another and run. Not fast, but sometimes far. Like many of us, I should do it more often. Medical bills are a burden for 1 in 4 families. Almost a third of U.S. adults will serve as a family caregiver for an ill or disabled parent or relative in any given year. And this responsibility affects lower income families disproportionately. More of these caregivers are women, and a majority also work full or part-time. Many women today find themselves caring for children and caring for aging relatives or parents at the same time. Students frequently ask me how I find a balance in my work and my home and personal life, and I will usually say I'll let you know when I figure that out. But I certainly could not do what I do without the support of my family, and especially my husband, Gus, and his parents as well, who are here tonight. With more women in the workforce, more fathers with working spouses are providing regular sources of child care than ever before. Someone told my son that he would be the man of the house when my husband went out of town. My son asked if that meant he had to do the dishes. That's frequently my husband's position in the house when we're at home. I don't have an easy answer to achieving work-life balance. It will be a lifelong balancing act and negotiation. I also don't know what I would have done without my Child Study Center family. So the ETSU Child Study Center, they were my children's primary daytime caregivers for the first 4 or 5 years of their life. And colleagues there and I continue to collaborate on continuing education conferences and community events, and my kids and I go back for visits. Going back to high school. So my best friends and I worked on our 10-year plans at high school graduation, and I kept them all in a box. One of my friends planned to be working in Hollywood, one planned to be married, and a statistician. We had diverse goals. I said I would be a doctor and living in a house on the coast of California 10 years after I graduated from high school. Well, there's definitely something to be said for setting goals and making plans. We each achieved ours, at least mostly. I did become a doctor, and I did live in California. I never really had a house or lived on the coast, but I lived close to it. Because of my father's position as a physics professor, I grew up in part on a university campus. So going to basketball games, playing with microscopes and blackboards, sometimes with liquid nitrogen. Throughout high school and college, I worked in my dad's physics lab. At the University of North Carolina, I did not major in physics. I majored in chemistry. Physics just never clicked with me like chemistry did. My dad was a popular teacher and a masterful researcher in solid-state physics. One of his areas of research was light-emitting diodes and blue lasers. President George Bush Sr. visited and toured his lab in the early 80s. Growing up, I actually always assumed that my dad would win a Nobel Prize. In college, I became interested in medicine and interviewed and became what was called a health professions advisor at UNC. So someone who would mentor and advise other students who were interested in health professions, including medicine. So you had to apply for this position and you had to be interviewed in order to be accepted as a health professions advisor. I ended up being interviewed by someone named Gus, my future husband, who was a class ahead of me at UNC. I was accepted and approved to be a health professions advisor my senior year, and Gus later admitted that he actually took that position to meet girls, and I guess I fell for it hook, line, and sinker. Sorry, Hannah. Like many budding medical students, I volunteered at our hospital during college, and literally, the second I began walking through those doors, I became excited. My adrenaline got going, and somehow I just knew that's where I wanted to work someday. I completed medical school after college, also at the University of North Carolina. While at UNC, I took a class that first sparked my interest in public health. It was popularly referred to as the AIDS course at UNC, but more formally titled AIDS, Principles, Practices, and Politics. It was a 1-hour course that was, and I quote, designed to illuminate the complexity and multidimensionality of the evolving phenomenon known as AIDS as a paradigm for the relationship between disease, society, and public policy. At the time, HIV and AIDS had only recently emerged, and science, medicine, law, and society were still trying to catch up. I remember, in particular, a patient panel discussion in that class that particularly affected me. It included a man diagnosed with HIV who spoke of the discrimination he faced, the medical appointments, the costs, and more so the loneliness. I later read and studied, and the band played on, and anything I could find about the HIV and AIDS epidemic. I visited the AIDS quilt as it toured in DC. And I received training at our local Red Cross to become an HIV counselor for our student health services. In addition to some of the amazing dual degree holding faculty members at UNC, that class is the main reason I pursued a master's in public health and epidemiology after medical school. Moving forward, my husband and I entered the couples match after that for residency. We both matched at Stanford University, he in medicine and me in pediatrics. We got married. Silicon Valley was a fascinating place to live at that time during the rise and the boom of the dot-com industry. My husband even started his own .com during residency called Doctor on Call. He was this close to getting venture capital when the bubble burst. It was still fascinating. Residency was hard, exhausting, but some of the best years of my life. I really had no time to think about public health during residency. I was learning how to take care of patients. Some of my memories, seeing a 4-month-old continuity patient, reading a book that I had given him as part of our Reach Out and Read program, crying on oncology rounds with my team, intensity of managing in the hospital, burn patients, transplant patients, just very ill children. In medicine, we're privileged to touch people's lives and provide our service during some of the most intimate and significant events in people's lives, so birth, illness, death. California was also an amazingly diverse place to work in terms of languages, race, ethnicity, and others. I spent more than 2 years working at Stanford after residency, teaching in an HCOT program, mentoring program, doing research and working as a general pediatrician and hospitalist. And it was there I started to understand the importance of mentors and seeking them out. So my chairman at Stanford spoke often of the importance of mentors, and more so he acted as one. And as I mentioned, I became aware then and have continued to be aware that it's important to seek out mentors in your career, be they supervisors or peers, formal or informal, lifelong or brief. I came to UNC in 2003 because my husband was going to work at his father's startup company, Yasu Health, that was actually housed in the ETSU Innovation Lab. Our friends in California thought that I should stay there while Gus went on ahead just to make sure it worked out because they could not imagine life in Tennessee. Well, we made the trek across country very excitedly, and at ETSU, I've tried to take advantages of opportunities as they've been presented to me early on. I served on the Institutional Review Board, or IRB, for Human Subjects Research. I haven't had anyone give me $1 million yet, but I was early in my career asked by Bruce Behringer to lead a research project on substance abuse among adolescents in the region with Wake Forest University, and that was provided a lot of valuable experience. Several of my mentors have taught me a lot. Bruce Behringer is one, taught me a lot about community health, community partnerships, and that place matters in health, and that here in Appalachia and the Appalachian region, we have health disparities, as well as what he would call double disparities of racial and ethnic minority groups in Appalachia. Early in my career here, I became involved in school health and worked with colleagues at ETSU in nutrition and pediatrics, as well as schools in the area to develop an obesity prevention program called Winning with Wellness. And one of the women I admire from that time is Connie Gibbons. So she has passed on, but she led establishment of coordinated school health in Tennessee. That is based on a CDC model. It's now present in every school system across our state, provides valuable data to monitor school health and children's health and support for improving health in our local school systems across the state. I also met some former notable women recipients and current notable women recipients shortly after arriving at ETSU, including Beth Bailey and Amal Curry, because of some of our interests in maternal child health. Other mentors have really reached out across colleges, across departments early in my career: Fred Tudiver, Joellen Edwards, Taejeon Woo, and Will Dalton. And then my fellow pediatricians at ETSU in our department, and my friends, and pediatricians in this region and also across the state have been mentors and friends, and I greatly respect them. Dr. Mills is here tonight, and several of our pediatric residents have been here, Dr. Gavernini, Dr. Champney, and Dr. Jay Shanker. I appreciate y'all coming, and as well as our new chairman of pediatrics, Dr. David Wood, and our dean. So, I have recently decided that I am a tinker. Regardless of how you feel about the princess fairy genre, it has been ubiquitous in society in the past decade, and my family, my daughter, was not immune to its allure. While my daughter recently announced that princesses are stupid, and she is actually not allowed to say that word, she had been in her youth entranced by them. So, and fairies are now sort of princesses too. Tinkerbell is no longer the tinkling, mute, mischievous, tiny being who was a secondary character in Peter Pan stories from my youth. She's a leading lady, and she has her own movie series. These new fairies are born of a baby's laugh and live in Pixie Hollow. There are actually many different kinds of fairies: water fairies, nature fairies, light fairies, dust keeper fairies, fast-flying fairies, and tinkers. Each of these groups of fairies has a role heralding in the changes of the seasons on the mainland. So Tinkerbell was and is a tinker fairy. What does a tinker fairy do? They make useful things. They fix things. They try to make things better. Tinkerbell can be annoying to her friends in some ways because of this, and I think that's one way that sometimes I can be annoying. There's the old adage, if it ain't broke, don't fix it, but I somehow just always have the need to tinker. And it's not necessarily that things are broken, but just how can they be better? How could they be improved? Like Tinkerbell, I am not patient. I'm an impatient person now, and it's not making me grow into a very good researcher. I want to change things, and I want to change them now. And I'm sometimes frustrated by the slowness of progress that can be achieved as an academician, given our triple objective, but very important objectives in academics of teaching, research, and service. So how do we accelerate improvement? Take research from the bench or field to policy and practice faster. So one other comment, and then I'll transition about the fairies of today. All those different types of fairies learned that it was very essential to understand each other's roles and responsibilities in their work. And if they worked collaboratively in interprofessional teams, they would be effective in heralding in the seasons. So I've been involved in interprofessional courses at ETSU for the past 7 years, and I've served on the Interprofessional Education and Research Committee. And I'm a strong believer in that approach to education, with collaboration between health professionals and teamwork as being a way to accelerate improvement. I've had the opportunity to work with men and women across campus and have learned a lot from them. I think the collaborative spirit and leadership in interprofessional education and research makes ETSU unique and is one of our institution's greatest assets. It holds a lot of promise for tackling hard issues in our region. So I said at the beginning I was going to talk about, as my mom suggested, what else needs to be done. So I'll get back to the status of mothers and children and their health. Unfortunately, we are faced with the highest rates of child poverty in 2 decades. 25% of children in the U.S. don't have enough food to eat on a regular basis, and 7 million are uninsured. There was recently a documentary airing on PBS about the impact of toxic stress and infant mortality, and this is an important measure that we use to look at progress in maternal child health. U.S. ranks 56 in the world for infant mortality, and that measures death of babies prior to their first birthday. We are fourth highest among 29 developed countries in the world. In Rochester, New York, Black and Latino babies are still dying at 3 times the rate of white babies. Some of the reasons for infant mortality include serious birth defects, premature births, sudden infant death syndrome, or SIDS, injuries, and maternal complications during pregnancy. So it's complicated to address these issues and to improve health. One of the things that we've done in our clinic, our pediatric clinic, over the past few years, with collaboration from colleagues in psychology and public health, is to begin screening for postpartum depression. This is something that we had not done before, and as pediatricians, we're not usually the primary caregiver for women. Because of this interprofessional collaboration, the presence of behavioral health consultants from psychology under Dr. Jody Palaha's supervision in our clinic, we were able to move forward with that and actually develop some programs and initiatives to help address that, because we know that infant health and children's health is really tied to mother's health and well-being and mental status. We are this year, through support of an ETSU interdisciplinary research grant, implementing a program called the Family Checkup, again with psychology and public health in our clinic. And this is going to allow us to better screen for and help families with behavioral problems in young children. And this holds prospect for preventing future problems, including issues like substance abuse later in childhood and adolescence. So we're very excited about those initiatives. One of my areas of interest in research, as was mentioned previously, is obesity. And it's fascinating and that there is present in our society these two problems at the same time that don't seem like they go together. So the increase in obesity in our society, including among children, it's doubled or tripled over the past several decades, and yet we still have a huge problem with food insecurity affecting so many families. In Tennessee, women have among the highest prevalence rates of high blood pressure, obesity, lack of leisure time physical activity, and smoking in our nation. And maternal deaths during childbirth are the highest that they've been in nearly a quarter of a century. Again, reasons for that are complicated, but it's thought that in part they are due to the increase in number of women entering pregnancy with chronic conditions like high blood pressure and obesity and diabetes. Still, in our great nation, life expectancy continues to rise. Life expectancy for females is 81.2 years. For males, it's 76.4 years. And it's continuing to rise. There's some concern that there could be a turnaround or a change in that with our current generation of youth, given the epidemic of obesity and its consequences. And hopefully not, with the technology that we've developed and services and research. But there is concern that life expectancy of the current generation could be shorter than that of their parents. Technology has certainly played a role. Reasons for the rise in obesity are mainly due to changes in the physical and social landscape in our society, including development of technology that's made us all a bit more sedentary. At the same time, technology has resulted in amazing advances. So my dad did not go on to earn the Nobel Prize in Physics. However, the Nobel Prize in Physics was awarded to 3 other scientists just a couple months ago for developing the blue LED. And I'm proud to say that his work and his lab's work was definitely a part of paving the way. And that invention has certainly transformed the way that we light our world, the way we watch movies, and the way that we store data. reasons to be hopeful. So we have some amazing leaders at the state level who are working hard to ensure that progress in Tennessee, improvements in infant mortality can continue, and improvements in maternal child health. These are in the Tennessee Hospital Association, the Tennessee Initiative for Perinatal Quality Care, and in our professional academy, the Tennessee AAP. And actually, leaders in each of those organizations are women. We also have some amazing leaders locally doing obesity prevention work. I've been honored to be part of an interprofessional team that's been led by Dr. Deborah Slauson in the College of Public Health called Team Up for Healthy Living. And she has done an amazing job of serving as principal investigator for that project and coordinating a huge team of faculty and staff and students from various departments. And that research project is addressing obesity prevention among high school students in schools across all counties in our region. One of the pediatricians who's here tonight, Dr. Heather Chaney, is a former graduate of our pediatric residency program, and I have been amazed at what she has accomplished in terms of child obesity prevention. She works in the Niswonger emergency room and has been, at the same time, a strong advocate for community health and wellness and children's health. She's taken on grant writing and has achieved funds to establish community garden and walking trail, as well as health education with mobile kitchens in a local elementary school. People like my husband, so in addition to being a dishwasher and a physician and helping to run a company, he's an amazing soccer coach. So helping to get kids out there and active and learn lifelong skills in a sport that they'll enjoy. As was mentioned before, one of my other current projects is called Read and Play for a Bright Future. This project's funded by the Tennessee Department of Health, and it aims to promote healthy, active living among families with young children and expectant parents. We have 5 kind of key messages and areas that we're addressing. So playing together, being active as a family, playing more, shutting off the screens, fueling to play, eating healthy, and playing safely. And with this project, our faculty and residents and students, along with colleagues across campus and a number of community partners, have developed clinical tools to improve counseling during well-child visits, as well as linkages to opportunities in the community for learning more about raising healthy children, as well as opportunities for physical activity. So that's something that we're very excited about. I'll just touch on a couple more areas that are related to that project. As was mentioned before, when I first came to Tennessee, I helped to start a regional breastfeeding coalition, and the BABE, Breastfeeding Advocacy, benefits everyone. As I came here from California, I noticed how few of my patients were breastfeeding. So the first thing I did was try to meet other colleagues and people working in this area in the region. And we formed a coalition, did some grant writing, did some education for professionals, and tried to improve support for breastfeeding in the region. One of those things that we developed, and it really wasn't my idea, it came from a health department peer counselor and was kind of developed through a coalition meeting, was the Baby Rest Stop. And this is just a place to feed and change your baby at community events and festivals in the region. And so we do dozens of baby rest stops throughout the year, and actually called to do that. And really just as a way to show support for breastfeeding and provide that service to mothers. Dr. Jillian Reese is currently, she's not a doctor, I promoted her. Jillian Reese is currently the president of the Babe Breastfeeding Coalition. And with her background as a graduate in public relations from ETSU, she has expanded the support in the region by leaps and bounds, establishing support groups, continuing and expanding the Baby Rest Stop, building peer support through social media and online support groups. The other thing that I think is exciting and is part of me being a tinker is the use of quality improvement methodology to affect change. And one of the things we talk about in quality improvement in healthcare is that you have to break down silos. Once again, you have to work together as professionals, not separately, and collaborate, and also use facts, use evidence, use data to drive change. So I work with colleagues across the state in TIPQC, which is the Tennessee Initiative for Perinatal Quality Care. This is a quality improvement collaborative that addresses over a dozen now issues relevant to improving maternal child health in Tennessee. One of these projects is breastfeeding. So we did a pilot with a dozen hospitals across the state, working with them to implement the 10 steps to successful breastfeeding. And we're able to achieve a 20% increase in exclusive rates of breastfeeding. We now have a Wave 2 project that includes hospitals representing 75% of Tennessee's live births. So that's very exciting. And for people who don't know much about breastfeeding, it just has a huge number of maternal and child benefits, as well as benefits to preventing mortality and reducing healthcare costs in our nation. Our former last U.S. Surgeon General, Regina Benjamin, who was an African American woman, and when she served as our nation's highest ranking health official, that her call to action of her tenure was to support breastfeeding. So I'm happy to say that our region and our state are answering that call. The last thing I wanted to mention is a new project related to Read and Play that's addressing literacy in our region. So in Tennessee, in terms of children under the age of 6, 65% of those have parents with less than a high school diploma who are economically poor. Only 66% of our population of fourth grade students in Tennessee, 66% of our fourth grade students in Tennessee have a below proficient reading level. And this is very strongly tied to health outcomes, economic status later in life. So we are working with a number of partners in the region, the Children's Hospital, the Early Childhood Program in the area, lactation consultants in the region to build, hopefully in the future, comprehensive services, including adult literacy services in the region. But we're starting with children. Our academy, the American Academy of Pediatrics, released this summer their first ever policy statement on the role of the pediatrician in promoting early childhood literacy. So we do in our clinic here a program called Reach Out and Read, so giving free books to children at all their well child visits, so they end up with a library of dozens of books by the time they enter school. We've also developed our own children's book series, working with a local storyteller, Kathy Jo McMacken, and it is going to reinforce some of those themes I mentioned we're working on with the Read and Play project, as well as serve as a tool for early literacy development. And we just have our first book out this summer. We're also working to build support groups for parents and families in the region that are going to include breastfeeding support, support for parenting in terms of raising healthy children, as well as a literacy initiative to show families how they can use books with their children more and reduce screen time and some of our technology that we have to promote early literacy and early development. So I see a lot of hope in our region. I see it in my children, who are amazing. Sometimes I don't understand where they came from. They are young in their kindness, their understanding at such an early age. Their easy humor always amazes me. There's a quote that one of our staff members in pediatrics circulates in her emails a lot from Jackie Kennedy. If you bungle raising your children, I don't think whatever else you do matters very much. So I like that quote. It also scares me since I'm a mother. But the one thing I've learned is that children are strong and they are resilient. My students, I've recently started teaching in the rural primary care track again, as well as teaching in more interprofessional courses, and I have a group of students in Mountain City, so I'm getting to know that community. We're actually headed to Pigeon Forge first thing in the morning for the Rural Health Association Conference here in Tennessee. And then finally, our pediatric residents at ETSU, we currently have 18 pediatric residents, and they are all amazing, very skilled, intelligent, and very mature. When I think back at myself when I was a student or a resident, I don't remember being that good. So it gives me a lot of hope for the future. So I think we are weaving our own quilt here across the region. I actually with our initiatives and programs and promises for the future, and I actually think of it as a receiving blanket, strong, soft, warm, and hopefully large enough to welcome the next generation of babies and their mothers and families into an even healthier, safer world. So thank you very much. I appreciate the opportunity to talk tonight in this award.